You're standing in your kitchen, holding a small pill bottle you've taken for months, maybe even years. It could be for your thyroid, your blood pressure, your mood, or just something simple like a pain reliever. Yeah, before it was routine. Now everything feels different. You're pregnant or trying to be. And one question keeps coming back: is this safe for my baby? This is one of the most common concerns I see in real clinical practice. And the honest answer is it's not always a simple yes or no. Because once you're pregnant, medications don't behave the same way they used to. Your body is changing in ways that directly affect how drugs work. Your blood volume increases significantly. Your kidneys filter faster. Hormones shift. And most importantly, the placenta forms. This is the interface between you and your baby, and many medications can cross it. What enters your bloodstream can reach your baby too. But here's what most people don't realize. Not all medications carry the same level of risk. Some are well studied and safe. Some require careful adjustment, and some should be avoided because they can interfere with development. The key is understanding which is which and why. To understand that clearly, you need to look at what's actually happening inside your body. In early pregnancy, especially during the first 8 to 10 weeks, your baby is forming all major organs. This stage is called organogenesis. It's a highly sensitive window. During this time, certain medications can interfere with how organs develop, sometimes without any immediate warning signs. That's why timing matters more than most people think. A medication that may be acceptable later in pregnancy can carry a much higher risk in the first trimester. And this is where it can become a problem because many women don't even know they're pregnant during these early weeks. So if you've already taken something before realizing you were pregnant, don't panic. Most exposures do not lead to harm, but this is exactly why early medical review matters. Now let's make this practical and actionable. Medications during pregnancy generally fall into 3 groups. First, those considered safe when used correctly. This includes prenatal vitamins, folic acid, and medications like acetaminophen in standard doses. Second, those that can be used with caution. These depend on your condition, your dose, and the timing. For example, certain antidepressants or thyroid medications may still be necessary because keeping your condition stable is essential for your baby's development. Third, those known to carry risk. These can interfere with fetal development or increase complications and should be avoided unless there is a very specific medical reason. But here's the part many people miss. Stopping a medication on your own can be more dangerous than continuing it. If you're being treated for high blood pressure, epilepsy, thyroid disease, or significant mental health conditions, stopping suddenly can destabilize your body. That can reduce oxygen delivery, trigger seizures, or cause severe stress responses, all of which directly affect your baby. So the goal is not to stop everything. The goal is to adjust safely with medical guidance. If you ignore this part, you may unintentionally create a bigger risk than the medication itself. Now pay close attention to how your body responds. Pregnancy changes how drugs are absorbed, distributed, and eliminated. Even medications you've tolerated for years can feel different now. You might notice dizziness, unusual fatigue, palpitations, persistent headaches or nausea that feels more intense than typical morning sickness. These symptoms don't automatically mean something is dangerous, but they are signals that your body is responding differently and they need to be taken seriously. And this is where monitoring becomes essential. But here's something reassuring. When medications are chosen correctly and monitored properly, most do not cause harm. The real risk often comes from confusion, delay, or relying on incomplete or misleading information. And this is where many people go wrong because they turn to quick advice online instead of grounded medical guidance. You may hear things like just go natural or avoid all medication at any cost. But this is where it can become dangerous. Because natural does not automatically mean safe. Many herbal products have not been studied in pregnancy. Some can affect hormone levels. Others can stimulate the uterus or interfere with early development. So anything you take, no matter how harmless it seems, needs to be reviewed. And here's what most people don't expect. Sometimes medication is not the risk. Not treating your condition is. I've seen women with severe nausea in pregnancy, what we call hyperemesis, who can't even keep water down. And they're afraid to take anti-nausea medication because they've been told to push through or rely on home remedies. But the clinical reality is this: severe dehydration and electrolyte imbalance pose a much greater risk to your baby than a properly prescribed medication. In those situations, medication is not optional, it becomes necessary. And sometimes treating the mother is exactly how you protect the baby. If you ignore this part, you may unintentionally put both at risk. So here's exactly what you should do next. Start by listing everything you take. Prescription medications, over-the-counter drugs, herbal supplements, vitamins, even occasional use like sleep aids or painkillers. Because many risks come from things people don't even think of as medications. Next, review this list with a qualified doctor as early as possible. This step matters more than anything else. Because safety in pregnancy is not based on general rules. It depends on your specific situation. Your condition, your dosage, your timing, and your medical history all shape the decision. This is where personalized care makes a real difference. From there, follow the adjustments carefully. This might mean switching to a safer alternative, adjusting the dose, changing the timing, or continuing the same medication, because stopping would be the greater risk. And this is where a lot of fear starts to settle, when you realize you don't have to guess, you just need a clear plan. Now let's make one thing very clear. There are situations where it's safe to monitor, and others where you need to act immediately. If you've taken a common medication at a normal dose and you feel well, with no unusual symptoms, it's usually safe to monitor while arranging a medical review. But if you're unsure what you took, especially in early pregnancy, or if the medication is known to carry risk, you should seek medical advice sooner, and you should not wait. If you experience severe abdominal pain, vaginal bleeding, persistent vomiting leading to dehydration, severe headaches or vision changes, or any sudden intense symptoms, these are warning signs that require immediate attention. And this is where it can become serious, not just because of the medication, but because of how your body is responding. Let's bring this back to something simple and steady. Most women who take medications before or during pregnancy go on to have healthy pregnancies and healthy babies. Your body is remarkably resilient. It is designed to adapt and protect, but the safest path forward is not guessing. It's clarity. It's knowing what you're taking, why you're taking it, and whether it still makes sense at this stage. Because when you understand what's happening inside your body, you move out of fear and into control. And that changes everything. So if you're holding that pill bottle right now, unsure what to do, don't stop blindly. Don't ignore it either. Pause, review, then move forward with a plan that is medically sound, personalized, and safe for both you and your baby. And that's how you stay in control, and that's how you stay safe. If you found this clarity helpful, join our community at ClearMom Health so you never have to navigate these difficult questions alone. So your baby's safety starts with your peace of mind, and we're here to help you protect both.